Are you tired of looking tired? In this video we're going to talk about non-surgical treatments for treating the under eye. My name is Doctor Sanjay of Trick One Aesthetics Mayfair. When it comes to treating the under eye, it all depends on the anatomy. Everyone changes in slightly different ways and everyone has slightly different requirements. At the most basic level, it's going to be people who are starting to notice fine lines and wrinkles, and they're starting to notice small changes in the appearance of their under eye. For this type of patient, it might be more suitable to just start with skincare. So optimizing skincare for under the eye itself is a minefield because there's millions of different types of skincare, some more effective than others. If you want to get some recommendations on ones that we would typically advise, we normally gravitate more towards medical grade skincare because this is the type of skincare that's got a significant evidence base, clinical trials, lots and lots of data of good patient outcomes. For that type of treatment, the best thing would be to organise a consultation where we can make some recommendations for the best type of skincare for you. The next level up with fine lines and wrinkles could be more to do with the muscle connected around the eye getting stronger over time. As this muscle tightens, it's responsible for producing all the fine lines and wrinkles around the eye. This muscle is called the orbicularis oculi, and it's one of the commonly treated muscles with Botox injections or anti-wrinkle injections. The main premise of this is by relaxing part of the muscle, it softens the area, and all the kind of tightness of the muscle that's giving the fine lines and wrinkles, it relaxes, and then the fine lines and wrinkles go. With this type of treatment, there's a spectrum. One end of the spectrum is natural look injections. These are more like baby Botox, whereby we've got very gentle dosing, you can still express, it helps fine lines and wrinkles reduce, but it doesn't completely eliminate them. The other end of the spectrum is more towards frozen look Botox, and that's with higher dosages where we want to eliminate movement and try to reduce fine lines and wrinkles as much as possible. For most patients, they're going to sit somewhere within the spectrum. The next issue is going to be to actual volume loss. Now, with sunken under eyes or with tear troughs, this can either be genetic or age-related. The most easy way to tell this is if you've been bothered by your under eyes from before the age of 25, it's probably more genetic because some people have got more sunken under eyes than others. In this type of person, they might need something like a tear trough filler treatment to add a little bit of volume under their eye, and that's going to help improve the sunken appearance. Someone over the age of 25 who's getting more bothered by this over time, that's going to be more age-related issue, and that's going to be more age-related volume loss. Now, over time, we lose volume in the layer of the bone and the deep fat. It sounds very strange, but these are areas where when we lose support and structure, it starts to create hollowing, and volume loss. So in the area of the mid-face and under the eye here, these are areas of the skull that actually lose bone volume most aggressively. So it's very common for these areas to get worse over time because the actual structure of the face is slowly starting to change. In this type of patient, we would go more towards a dermal filler treatment where we're essentially looking to restore the mid-face and treat the tear trough area by restoring volume that's been lost. That's going to improve shadowing, it's going to improve the volume loss, it's going to improve the actual groove or the trough itself, and it's going to improve light reflection of the under eye. Finally, the last treatment I'm going to discuss is called a polynucleotide. This is a regenerative medicine treatment. Again, it's injectable. What this is little injections under and around the eyes, and essentially these injections are going to improve fine lines, elasticity, hydration, improve the skin quality overall, and actually rebalance pigmentation. So this is one of the few treatments that we can offer that's going to help with dark circles because the actual pigmentation is going to improve more so with a polynucleotide treatment. The way this works is it's a DNA level treatment that targets your fibroblasts and it triggers your fibroblasts to produce more collagen, more elastin, and rebalance your pigment. It can be quite tricky understanding whether you're more suitable for a tear trough treatment, this is restoring volume that you've lost, or a polynucleotide treatment, which is more addressing a dark circle. For that, the best thing to do is have a consultation with a doctor where they're going to do certain tests and an analysis during a consultation to try and figure out how they can best help you with your concerns. So to summarise, trying to help someone whose main concern is their under eyes, really it depends on their anatomy and what's going on. For some people, we can help it by improving skincare. For some people, it can be more about trying to restore volume that they've lost in deeper layers of tissue. For some people, it can be more about trying to improve the skin quality in a more tangible way via injectable treatments. So there's a whole range of possibilities, and it's about finding the best treatment tailored for the right patient. So I hope you found that useful. I've mainly covered the main non-surgical ways that we'd go about trying to treat the under eye. If you've got any other questions about how to treat tired looking eyes or anything else at all, please do give us a comment and we'll get back to you. Thank you very much.